Hey, Dr. Josh Wagner here, Patient Mastery. I'm still out here in Beverly Hills with another important DC mindset mastery video for you. Now, one of the most important aspects of our profession and one of the areas that we sabotage ourselves so much is our fees, our value, and our worth. And no matter what, if you're in practice, you are a business owner first, even before a doctor. And that doesn't discount or discredit the value or the importance of being a doctor, but if you can't keep the business open, then you can't be the doctor. So with that aside, there's more often than not, we have such self-sabotage when it comes to our value and our fees and our worth because of a couple reasons. The first is we associate our value with how much time we spend with a patient, the relative how hard it was to deliver that adjustment, to learn to deliver that adjustment, or maybe the modality, how long we are taking care of a person, whether it's a few weeks, a few months, and we start putting our value based on those metrics, which it's really not. And so what happened years ago, insurance came about and practice management realized, oh, well, now we can figure out a way for doctors to really get what they're worth. We'll just have them see the patient so many more times. So literally, I've been part of practices that a typical care plan was 125 visits in a single year. Now, if you're thinking, oh, well, I only recommend 36 visits, listen, to a patient who's coming off the street, who's never had to go to a doctor more than 6 times, even if it was an oncologist, that still raises incredible amounts of red flags. So you're still sabotaging yourself by recommending that. But if it wasn't enormous amounts of visits for no matter what someone walks in for, it was, oh, we can get reimbursed for all this other stuff. And then of course we have chiropractors charging for everything, and there's nothing wrong with doing modalities as long as you believe in it. And then there's always, that causes the disunity and the infighting in chiropractic and all this aspect that happened because insurance came in and chiropractors were recommended do all these other things to get reimbursed more. Now, what's the point? The point is that either way, more visits, more modalities is still coming from a lack perspective. It's still coming from a perspective of we have to do more and justify what we're getting reimbursed for. And if you think you're getting reimbursed for your education, for your adjustment, for the time you spend with them, for the number of visits you do, for the modality, for your expertise, if you think you're getting reimbursed for any of that, which you probably do, which is normal, because that's what we've been taught and that's what we inherently think, we're self-sabotaging ourselves. So if you just switch to start thinking about the incredibly beautiful and wonderfully effective care you deliver, and you think that the majority of your patients who get 80 to 100% better of pretty much anything they come in with, and even the people who only get 30% better, but probably were only expecting to get 20% better, let's say it's like a real chronic systemic issue, what is the value to them of being pain-free and being able to get their life back? Like when you find out what's actually interfered in their life, not just what's interfered in their spine and nervous system, but the fact that they can't play golf when they love it, the fact that they can't play the weekend tennis, the fact that they can't work out, the fact that they can't be their best at work, the fact that they can't sleep through the night and they're more tired and more irritable at their spouse, the fact that even if it's just neck pain, every relationship is affected, because if you're walking around with a pebble in your shoe, you are more irritable, and that's how someone is going all through life. And just by removing that pebble, as simple as it was for you, is extremely valuable to that patient. And when you start thinking about when they get their life back because you helped them get their health back, removed the pain, got them over a condition, removed subluxation, however you phrase it, when you get their life back, what's that worth to them? A lot. And when you start valuing your care at even just a fraction of what that's worth to them, and you start, forget billing for every little thing you do. No, we're gonna work together to get this resolved, and it's going to be X. Think of a case fee, think of what I call time-based care. You'll start getting reimbursed a heck of a lot more than you do now, yet to the patient, it's gonna be a steal, and it's gonna be a deal compared to them understanding the difference in their life that they get back. Now, how do you do that? That's another conversation for another day. That's what I share with doctors in the program. But how to think about it, first off, is again, is your care, not your adjustment fee, care to work with them to get them 80 to 100% better. Is that is the difference what they're gonna get back in their life, what's currently missing once they're pain-free, once they're subluxation-free, once their body's functioning better, is the value of what they have in their life far, far more, value of what they're gonna get back in their life far, far more than whatever it is you're charging for the care. And then it's not about the visits, it's not about what modalities you use, it's not about how long you spend with them, it's not about your technique, it's not about any of that. It's about you being a trusted leader with them and making all the difference for them where they want to tell everyone about you and them loving the process. That's what I want for you, that's what I want for every chiropractor out there, especially if you're dealing with self-sabotaging thoughts around your value, your care's value, your worth, and mixed up with all the crazy recommendations that are given in this profession to try to bump up the monetary, but it sabotages you ethically and with what you know to do clinically. Thanks for watching. For more, go to patientmastery.com. I actually showed these types of recommendations in the presentation on that page. So I'll see you there. Until then, keep doing great work.